Being the most common cancer in the world, nowadays lung cancer has been a huge concern among parties. Welcome to a podcast where we discuss important health concerns across the globe.
Today, we're diving to the topic that affects millions worldwide, but mainly focusing on the country of China, lung cancer. Cancer remains one of the leading causes of death of almost million people in China each year.
In this episode, we will explore what causes lung cancer, the risk of it, and raise awareness to our audience.
Whether you're a healthcare professional, a patient, or just want to keep updated on the latest healthcare talk, this is for you. So with that, let's begin.
Today we have Ngobzang Chunzang
Convey.
our guest in today's episode. Now, Ngobzang, can you tell us the overview of lung cancer in China?
Sure. Lung cancer is the most common type of cancer in the world. In recent global estimates, the International Agency for Research on Cancer indicated that 2.5 million people are diagnosed with lung cancer and over 1.8 million people have died of the disease.
Fantastic. This statement indicates lung cancer as one of the biggest concerns in the healthcare industry and how many people it has affected, showing its severance and danger. Now, I wonder what are the causes of lung cancer, both globally and especially in China.
According to an article written by WHO in 2024, tobacco consumption made up most of the causes of lung cancer, responsible for 85% of cases. Another analysis shows that when schools' anti-smoking regulations are weak, risk of adolescent smoking peaks. This is proven by results of 191,000 adolescents across the globe. Students will be roughly 5 times more likely to smoke now, knowing they're not facing consequences for lighting a cigarette in school grass with their influenced friends.
Around 378,000 adolescents across multiple countries found out that having parents who smoke increased the odds of adolescents smoking by 2.18 times, while having close friends increased to 6.09 times. This justifies peer and family smoking influence.
In China, people getting diagnosed with cancer are increasing due to smoking. China is in the midst of a lung cancer epidemic on an unpredictable scale. In 2015, there are estimated around 733,000 new lung cancer cases and caused 610,000 deaths in China. Lung cancer is the most commonly diagnosed cancer and the leading cause of cancer mortality in China. Tobacco smoke exposure is the primary factor driving current lung cancer trends. In 2015, smoking prevalence was 27.7%.
The causes and statistics you have shared are quite extreme. Are there any new modern approaches to stopping lung cancer caused by smoking?
One technique that enables computers to learn how to predict certain events is machine learning. Researchers are certain that machine learning can detect lung cancer in CT images more accurately than pathologists or radiologists. In one artificial intelligence study, for instance, scientists taught a computer algorithm to identify genetic changes linked to cancer and diagnose 2 forms of lung cancer with 97% accuracy.
Surgery is frequently used to treat lung cancer in its early stages. Researchers are creating methods to improve the security and effectiveness of surgery. During surgery, the whole lung lobe containing the tumor is often removed. However, recent clinical research has shown that removing a portion of the afflicted lobe is just as helpful as removing the entire lobe in certain patients with early-stage NSCLC.
I hear the signs and consequences of it are also a great worry among people. Is that true, Chungzang? Do you want to share some information of this?
Yes, it is. The signs and consequences of lung cancer include, but aren't limited to, firstly, persistent coughing, often dismissed as a smoker's cough or pollution. Secondly, coughing up blood or hemoptysis. Thirdly, chest pain. Fourth, wheezing, shortness of breath. 5. Bronchitis and pneumonia infection, and lastly, fatigue and weight loss, all of which comprise health, both physical and mental.
Hence, a conclusion can be drawn due to various reasons affecting one's health listed above. Smoking and cigarettes should be held and dealt with utmost security and caution. While it may be cured by methods such as therapy, probation, medical and tending the fees. Simultaneously, flashbacks may be too much of a burden to be.
Right now, we are coming up with activities and events to promote our lung cancer campaign, such as anti-smoking campaigns in smoke stores, campaigns across rural areas to prevent smoking, and workshops that promote healthier alternatives and prevent addiction.
One organization I can collaborate with to support my campaign is the Shanghai Cancer Recovery Club, which is recently featured in an IASLC Lung Cancer News Q&A. Their mission is spreading the idea that cancer does not equal death, carrying forward the work of cancer fighting groups, and transcending life. This group provides a strong sense of survivors and patients who can share their life experiences, which would add authenticity and emotional depth to the campaign.
In addition to patient support organizations like this, I could also involve medical experts from institutions such as the International Association for Study of Lung Cancer, whose global network of researchers and clinicians could provide accurate information and the latest insights on treatment advances.
With that being said, our podcast has come to an end. After today's episode, we hope we have kept you informed and raised awareness about lung cancer. Smoking is like a credit card. You enjoy now, you pay later. Have a nice day.